Hello, welcome to another episode of Your Health Matters OC. My name is Dr. Clayton Chow. I'm co-hosting with Dr. Chin-Seo Kwon, otherwise known as Dr. CK. Hi, CK. Tonight, the topic is very dear to my heart. It is about mental health and mental wellness, and with us, we have Dr. Veronica Kelly, who's Chief of Mental Health and Recovery Services, and Ms. Annette Mugadishian, who's the Deputy Chief of Mental Health and Recovery Services. But before we have a conversation with our guests, let's go back to Dr. CK, and I guess you're going to give us the final reports on COVID?
I hope so.
Okay, all right.
So as you all know, you've probably been hearing on the news, the World Health Organization actually announced that the global health emergency for COVID-19 pandemic has ended, and that was May 5th. And nationally, our public health emergency for COVID-19 has also ended May 11th. But that doesn't mean COVID is not around. It's still around. It's still affecting individuals. But the good news is that we are in a different place than we were 3 years ago. We have vaccines to help prevent severe illness. We also have treatment like Paxlovid to help also reduce severe illness. But again, we still see cases. Cases have been reducing. But the numbers that we see on our website are reflective only of the PCR cases, positive cases. So they're a little bit biased towards people who are getting tested by their providers. But overall, the good news is that hospitalizations are also decreasing. So currently, or at least the last report, there was 83 hospitalizations and 9 ICU admissions. So the good news is our ICU admissions went into single digits. Now note that over the next 2 weeks, with all the adjustments with the public health emergency, the national public health emergency, there will be a pause with the numbers that appear on CDC as well as CDPH's website. So that may also affect our own numbers. But I think people should still remember that they need to take precaution, especially if there's someone at home who has high risk. For the vaccinations, there have been some updates. So the monovalent vaccine that are now available is really just Novavax. Johnson & Johnson actually is no longer recommended in the United States because we know that there was a lot of side effects with that. And we know that the bivalent vaccines are just more effective. So if you haven't received your updated booster or your bivalent vaccine, please see, you can go to My Turn, or you can talk to your provider to ask about what you're eligible for. I know there's some adjustments for kids and also adults. That's all I have.
Well, I think that the complication is there's so many things happen too fast that sometimes people are not caught up with it, right?
Right.
So to simplify it, the only vaccine that currently available in the U.S. is the Novavax vaccine, and the bivalent Moderna and bivalent Pfizer,
yes.
right? The original vaccine that was approved, the original 2 doses of Pfizer, 2 doses of Moderna, and the Johnson & Johnson or the Janssen vaccine is no longer available in the U.S. So it's important to know, right? Go to our website, ochealthinfo.com//COVID-19. We have a very nice table summarizing what is recommended currently for all ages.
Right.
Did I say that right?
Yes,
We have it up
you did.
there. Okay. So check with the site.
And then also, so you see half of us are wearing masks and half of us are not. And so this is reflective of our new future, I think, and our current state. Everybody needs to make a decision for themselves of what kind of protection they want to use. And so technically, if you are a higher risk or you have someone who is higher risk at home, you can choose to wear a mask. And if you're going to choose to wear a mask, wear something that's a higher level. So a KF94, KN95. Surgical masks can still be effective if there's nothing else that you have. But if you're in crowded situations, if you don't have a mask, then also just distance and good ventilation is important.
Right.
And then there's always treatment. So if you are 12 and up and have a high risk, or you have a condition that puts you at high risk, you actually may be eligible for treatment. And Paxlovid can be prescribed by your provider as long as you're within that 5-day period. So just know that there is treatment available. The good news with that treatment is it does reduce the viral load, so it can help you get over the side effects faster, so you can get back to your normal life faster. So there is information on covid19.ca.gov for treatment if you have any questions about that, but also seek advice from your provider.
Yeah. So if you run into a situation where your provider make it very difficult, or if you don't have insurance, or your insurance, make it very difficult for you to access it, really go to the COVID-19 website or to our website, ochealthinfo.com/forwards-COVID-19, and we'll guide you on how to get the Paxlovid, the treatment if you tested positive. And very crucial that you get treatment the first 5 days of infection, right? So now is a good segue to talk about one of the post-pandemic effect on people, right? So that's mental health. And mental health is also the Mental Health Awareness Month for May. So you see some of us wear green. All of us have the green ribbon. So welcome, Dr. Kelly and Annette.
Thank you.
Tell us, why is mental health important?
So mental health is as important, if not more important, than your physical health. It's really hard to function, to go to school, to pick up your kids, to go to work if you're severely depressed or you're experiencing symptoms of anxiety. So really important that we remember all of us have mental health. So it's really, really important we take care of it just like we take care of our physical health care.
Post-pandemic, briefly talk to us about the effect of the pandemic of COVID on mental health.
Right. So during COVID, what we saw was a shift. We saw a slight increase, and we're looking just at children aged 3 to 17, and just at 2021 itself, 50% of our kids reported experiencing some sort of symptom of behavioral health, whether it was anxiety, feelings of loneliness, agitation, anger. That's a really high percentage. And what we're seeing now, we know that 1 in 5 of us will experience a mental illness this year alone, not just at some point in our life, but this year alone. Yet only 55% of us will actually receive treatment for that. So it's really important we get the word out that our world has changed. It really has. COVID really actually shown a limelight, if you will, on the importance of mental health. And it is essential that we all attend to our mental health in the very same way we would attend to our physical health.
Okay. So Annette, you are the deputy chief, but you're in charge of all the operation of the county clinics and our contracted vendor. What did we see during the pandemic in terms of services?
Well, we did not shut services off during the pandemic. We stayed available to our clients. We made adjustments on people working from home. Through telehealth, through phone, but we had a physical presence in most of our sites for the community. And our crisis teams did not stop working. They were available 24/7. Our OC Navigator was available for resources. Our OC Links was available 24/7 to receive calls. But we also saw that our staff was burnt out, that they were tired, but they really came together in order to provide services.
One of the things that during the pandemic most of us talk about is, how the first responder have sacrificed, their family sacrificed for them to continue to serve the community. And I think in general, when people think about first responder, people think about firefighter, emergency room clinician, or ambulance driver. They don't ever think about our staff in the mental health field who continue to provide the on the street outreach, in the community engagement and treatment. We have many of our social workers, therapists, mental health clinicians, including peers that are going to people's home, responding to the crisis that the community has. And we don't ever think about it. I want to take this opportunity to thank our county team who tirelessly putting themselves at risk, putting their family at risk, especially the first year in 2020 when there was no vaccine in sight. And I remember we worked together to really train them, give them the public health approaches that they can keep themselves safe, in essence, keeping their family safe, and individual with mental illness and their family safe, right? We always talk about risk, the risk group, but they don't talk about how people with mental illness and substance abuse diagnosis are also at higher risk for COVID, and we've seen that, right? And I remember on the call with the state health officer, I kept pushing for that. I said, hey, you talk about people with chronic health condition that's at higher risk, but you never talk about people with mental illness that's higher risk. And there are lots of studies looking at how people with mental health diagnosis die in numbers, right, compared to the general public. almost equivalent to people with a chronic health condition like diabetes, etc. And so truly, these set of first responder, we really need to take care of them and appreciate them, because their work is not ending yet.
No.
In fact, their work now start to
That's
begin
Yes.
because of the effect of the pandemic, right? So what are you guys doing? Let's talk about what are you doing in taking care of our own staff, taking care of the mental health clinicians that are contracting with the county to provide the services for the community side by side with us?
Well,
I'm getting emotional
Yes,
talking about
that's
that.
okay.
Right?
During this time when everyone was hunkering down and all of our staff were in the trenches, we were just talking about this with one of our partner organizations, Project Kinship, that while all the healthcare providers were fully in hazmat gear, our behavioral health clinicians had a cloth mask. That's how we approach providing services, because it's so important that we make sure our clients are getting the medication that they need, that they are in a safe place, that they understand whether they get masks, all of those things. So it took a toll. We've been having really open conversations. We do in mental health and recovery services, we do a monthly town hall, one for our staff and another one for our contract providers. And we start every one of those meetings with a thank you for still being here. Thank you for supporting each other, and thank you for the work that you do for our community. I don't think that we said that enough. And it is really important to know that this really has taken a toll, just like all of us here. And all of the viewers are really impacted. Our lives have changed a lot. But we've been able to kind of move forward, and we want to really ensure that our staff know how important they are, how essential they were to our community, and that we appreciate everything they did during 2020, 2021, 2022, and currently. And this work continues. But they were really important. And I think just having you, Dr. Chow, say that here is really, it's going to make a big difference for those folks who still come to work, and we're still doing the job.
Yeah. And during the pandemic, right, gosh, it was just a couple of days ago. Mm-hmm. And we talk about the importance of providing the support for children, and you mentioned a little bit about the mental health for children. And we always think of school nurses and teachers provide that, but our staff provide a lot of support for the schools to support our children. If a family have kids struggling with mental health issue, how would they approach getting the care?
As I mentioned earlier, Dr. Chow, OC Navigator is a great resource for all of services for,
you guys see
for
the
the
sign
youth.
here, yeah? Okay.
But also we fund a lot of programs within the schools, and the big ticket, if you will, is peers. We create those wellness safe spaces within the schools that is comfortable for students to go in and just to talk to someone. And then they can be linked to a counselor, linked to treatment. But it's just getting them talking about their mental health and what their needs are. And also behind your insurance cards, behind your Medi-Cal card, there is a number in order to access mental health services as well.
Okay. So before we go in depth to talk about that, I'd like to share videos. And the set of video that you're going to watch is actually produced by our student filmmakers who participated in the Directing Change project. And you're going to talk a bit about that in a minute, right? But take a look at the video. So impressive.
Con có hiểu là mẹ đã làm việc cực khổ cỡ nào để con được sống ở cái đất Mỹ này không? Đây là cách mà con đền ơn đó hả? Con có biết rằng người ba người mẹ này đã rất cố gắng vì con không?
You okay? You've been spacing out. You also haven't been responding to texts. I know it's hard, but I'm always here to listen.
It's just, there's this tension between me and my parents. I'm scared of disappointing them. They've worked so hard, but I feel like I'm not seen by them.
No, I get it. Don't be afraid to talk to someone about this. I see you.
¿Qué pasa, cariño? ¿No has tocado tu comida?
No sé, es que últimamente me he sentido excluido.
Dios mío, ¿con esto otra vez?
Mamá, es que no me entiende.
¿Qué hay que entender? ¿Que te sientes triste? Toda la gente se siente triste de vez en cuando. Eso es normal. Ok. Mira, si realmente te sientes tan mal, lo que tienes que hacer es rezar unas cuantas veces y te vas a sentir mejor. ¿Ya?
Yeah. Yeah.
Welcome back to this episode of Your Health Matter OC. Tonight we are talking about mental health and mental wellness in the community, specifically the mental health condition of our community post-COVID. Should you have any questions for us, any of us here, during the show or after the show, just send us an email to yourhealthmatters@ochca.com. Again, yourhealthmatters@ochca.com. So tell us about the Directing Change program.
Sure. Directing Change is a program here in the state of California. It's funded through the Mental Health Services Act and focuses on prevention in our schools. So it really takes prevention from a youth perspective. So youth in our middle schools, our high schools, and sometimes in our universities and community colleges create 60-second PSAs, public service announcements, focusing on suicide prevention, mental health, and reducing discrimination and stigma around mental health. And so these students with their school advisors create these amazing videos. And really the importance of it is that these are youth talking to youth. We know that we would wish as parents, I'm a parent, that my kids would listen to me, and they hear me, but they don't really listen to me. They would listen to their peers. And this is really just an amazing opportunity. We've had amazing results with this program.
Yeah. So I was there that night, all three of us. I don't know, you weren't there. Yeah. It was last Friday?
Yeah, last week.
Yeah. And some of the video were just amazing. I was particularly impressed with the videos that was produced by the junior high kid. It's like, I don't know what I was doing in junior high school, but certainly not producing video, right? But powerful, and they did it with heart, I believe. I was teary with a couple of them, right? So, as a parent, if you're willing, I know you've done this publicly, share about your experience as a parent and how was that for you and how did you seek for help? Because as professional, when you are in the middle of your own crisis, I mean, there's a lot of confusions in what you do. Do share if you're comfortable.
Of course. So I come from a family that has a lot of other, diseases like we all do. So heart disease, addiction is one that runs in our family, and anxiety disorder and major depression. So my siblings have some of those. But my own daughter has experienced pretty serious anxiety disorder, and she began to treat that herself with cannabis. And so she would smoke a little weed, and that would kind of relax her a little bit until it didn't. And that escalated. I think that, coupled with the genetic predisposition for addiction, that led her to different substances to the point that she became addicted to opioids, specifically heroin. And it was just really to try and address her anxiety because we really weren't finding anyone who could actually help her address that as well. So it happens, these sorts of illnesses happen to all of us. The important thing is getting help, and she has help now and she's doing really great. But it is something that affects all of us. It doesn't matter if you're a clinician, you're a psychiatrist, or you're a teacher, or or you're a student. These are illnesses that impact all of us.
Yeah. So I know my own family, we also dealt with that, right? And I know you're going to grill me later, but what, as I mentioned before, even though we're professional, but at the point where you need services, you are so in a crisis mode that everything like a blur is very difficult. How do people access, what resources? I know we have OC Navigator, can you talk a little bit about that, Annette?
Sure. OCNavigator.org also has a chat function. And so you can chat with our OC Link staff that are there 24/7. They will link you to services at every spectrum. So if you just need someone to talk to, another peer, they will link you to the warm line, the NAMI warm line, where you can talk to a peer. If you are in crisis, they may link you to the D.D. Hirsch crisis hotline, or you could call 988 if you are in crisis. But they will talk to you and determine.
They want you to look at me.
Determine your level of service. And so they could potentially link you back to the county services, which may include a clinic visit. They may dispatch our centralized assessment team if you need immediate attention and an evaluation.
Is that a 24/7?
That is 24/7.
And then are there folks on the line that could speak other languages?
Yes. We, of course, have Spanish, Vietnamese. We have some other languages, but we also use the language line if we have difficulty in communicating. But also, if I could go back to the OCNavigator.org, at the top there is a language capability. So you can select your specific language, and the whole OC Navigator will be in your language.
So the screen will
That is
flip to the
correct.
language and give you all the
That's
information.
correct.
You know, we needed that.
Yes.
Right? So I have to say kudos to our team, the team that worked on that. But also, really, I have to thank the board supervisor for supporting it, because I know they are also helping us putting the link, the information on their own website. So kudos to us.
Yes.
I don't think many county has been able to do that, right? And I've gotten input from people who call OC Links, and what a lifesaver, right? Because clinician
Yes.
man the line, so they might ask you several questions that might seem uncomfortable, but they're there to help you to decipher what is most important for you. So what do mental health look like here in this county, mental health services? Let's talk about that. I'm hoping that
All
you're going to
right.
address the shortage of staff, right?
So, yes.
Be real about that. Let's
Yes,
talk
so
about that.
we provide mental health services prevention. So we're in about 86% of our schools. We're trying to prevent people from experiencing what my child experienced and what many of us have experienced. We have actual treatment, and then we have recovery support for people who are in treatment. The difficulty is, right now in our department, we're experiencing about a 24% vacancy rate. Throughout the nation, this is a historic time for us, a historic time where we just don't have people in this field anymore, and we can't churn them out of the educational institutions quick enough. It's really important for people to understand, and particularly people who look like all of us here, that providing mental health services, behavioral health services is an honorable thing to do. And it's a great profession. You can make a great living at it, but it is an honorable thing to do. So we are working with the state to figure out, and our local universities, in particular Cal State Fullerton, to figure out how we can get more people into the pipeline so we can get more folks, more boots on the ground, if you will.
So I'll give you an opportunity on that. Who do you hire in our system? What kind of professional, who will be eligible to come to work?
Great question. It takes all kinds. It is a multidisciplinary team from peers, which are an integral part of our services. You and I started that way back when, of hiring peers into the clinics. We have mental health specialists, which include licensed psych techs, licensed vocational nurses, and AOD counselors, alcohol and drug counselors. We have bachelor level, both masters, MFTs and LCSWs, both pre-licensed and licensed. And we have psychologists and psychiatrists, and it's a team effort, full approach for the client.
Basically, I think people ask me, well, who do you go see if you need therapy? I can share with you, my therapist is a marriage and family therapist, right? And I've been seeing her for years. So it's really, who do you feel the connection
That's
to,
right.
right?
That's
Not
important.
necessarily what's behind their name, right?
That's very important.
And so, because I know there's people who say, well, I want certain profession. I say, no, you want the person that you can have the connection with. But it's very difficult, very, very difficult. I'll tell you, I have a cousin who's seen a psychologist 4 or 5 years prior to her taking her own life. And in the letter she left for the family, she talked about how she never found a connection. And I just wish that we had a chance to talk about it and give her the advice that it is important for you to pay attention to who you connect with, because mental health, to me, someone shared their deep, dark secret with you is a privilege. Yeah. And so it really takes a connection rather than a degree to find someone who helps. What effort do we do in ensuring that our system of care support and attract people to come in and work for us? Because, let's face it, on the private side, they pay a lot more than the public side, right? So I know you laugh, but it is true.
It's true.
And it is an honorable work, and you really have to have a passion to work with the hardest population, the hardest patient in the community. So to share with us a couple of the effort that's happening. Am I putting you on the spot?
No, but I can't word it any better than you have. The staff that we have are mission driven. They aren't out there with private practice being able to pay more. They are really dedicated to the population that we served. It takes a very special person to want to work with that individual. And you are right, the relationship is very important. And clients, if you're seeking services, you need to feel empowered to say, this isn't a good fit for me, I would like another therapist. The relationship is very important.
Yeah, because people don't know,
right?
Especially people who first time in therapy. How do you know what that is supposed to be like, right? We'll talk some more, but there's a couple more videos that was produced by our students.
Right.
We're gonna watch them. And then I understand that there's a statewide competition.
Yes.
So you're going to come back and tell us how to vote for those, right?
Yes.
Okay, let's take a look.
Because that will really just... Nick. What? Just don't forget that on the essay, okay? Yeah.
Nick. Come on, Nick. Let's go get some help.
And sometimes that sensation just takes up all the space in my brain, and I just can't focus on anything else.
It sounds like you have something called sensory processing disorder, Nick. It's something that a lot of kids and teens experience.
And though it may be difficult and it may take some time for me to adjust, I can get through this. So thank you for helping me reach out.
My friend hasn't been acting like herself. She's usually a bubbly person, always wearing a smile, and has a chic personality. She usually likes to hang out with me and our other friends. She especially loves playing the violin together. But lately, she started to change. She stopped putting effort in her appearance and often looks tired. She turns down every opportunity to hang out. She even stopped playing the violin. I asked if she was okay, and she kept claiming that she was fine. I believed her until she texted me thanking me for being a good friend, and she enjoyed every moment together, then saying bye. That's when I knew I had to take action, and took her to a trusted adult to get her the help she needed before it was too late, because that's what friends are for. If you or anyone you know are struggling with thoughts of suicide, reach out to an adult or call this hotline.
Welcome back to Your Health Matter OC. Tonight we are talking about mental health and mental health awareness. Just in case you haven't noticed, we switched seats. Dr. CK and I are now on the hot seat, but before we get grilled, just remind you that if you have any question for us during the show or after the show for any one of us, send us an email to yourhealthmatters@ochca.com. So we were talking about the directing change. What happened today?
Yeah, so today the state of California had the actual statewide award ceremony, and Orange County had a number of films that were up. Two in particular we were very excited about, and we found out 2 o'clock today that the results are in, and that Woodbridge High School actually took first place in suicide prevention.
Wow.
And they're from Irvine, and that a University High School in Irvine also took third place in mental health. So that's really exciting, and the videos are available was on our websites as well as at the Directing Change website. So please, please take a look at them. They're amazing.
So are those the two that we just showed?
Yes, those are the two we just showed.
By coincidence, right?
We knew they were mental health.
Sure. My intention was to become a surgeon, and midway through my deep, dark depressions with a suicide attempt, and luckily, I can remember the school vice dean caught wind of it and was really pushing me into a treatment. And I went to medical school in the University of Minnesota. You know, I was the first few refugees medical student that I ever had. I'm not that old. It was in the late 80s, right? But I was the very first refugee, so they never knew what was happening. And they didn't know what to do with me. I mean, they referred me to treatment, and again, to a psychologist that has no experience in treating refugee. And the first 2 months of treatment, I was getting nowhere because he was foreign with how I was feeling, what I was going through. But luckily, there was a Korean psychiatrist whose husband was on sabbatical at the University of Minnesota as a heart surgeon. And she went to Minnesota with him from DC. And so she volunteered her time with the medical school, and she got a hold of my case, and then she saw me and do assessment and treatment, and clearly found out that I have severe PTSD and depression, and get my road in treatment. And it was amazing because I found that connection that we talked about earlier. In this case, she happened to be a psychiatrist, right? But we walked through the issue, and I eventually chose psychiatry as my career, right? Because I found that calling, you know. Right. But it was very difficult. Like I said, as a medical student, you went through classes that talk about mental health, and you didn't really pay attention about it until you really had it, and you go, oh my goodness, this is what it's like. This is what it's like to walk in somebody's shoes. And then I shared earlier that I have a cousin who died from suicide. So it runs in my family, and we didn't know for a couple years that my cousin died from suicide because they live in a different state. And so my uncle finally called the family and said, hey, this is what happened, right? Because I knew she was depressed and was in treatment, but didn't follow up and didn't know because the family been very secret. I mean, just like any family, but that's the big stigma. And so come to find out that we have relatives that also attempted suicide in the past when I was just a little kid, but the family kept secret about it, right? And so it meant that depression and illness runs in the family. And then I have, niece and nephew that got depressed, and we knew that the danger of untreated mental health, so we were very forceful, if you will, in encouraging family to get into treatment. But I tell you, I've always say this, for those of us who have private insurance, the treatment option is very limited, yes, despite the fact that we have parity in mental health, right? I mean, for people who qualify for mental health services with the public system, we have tons of services program available, but for those of us who have private practice, it's very limited, right? I was lucky that I found this therapist, and I've been seeing her for 2 decades now since I moved back to California. But I remember when my niece and nephew needed treatment, my friend needed treatment for their children, especially therapists and psychiatrists that treat the younger population. There's a scarcity. Nobody take insurance almost, right? The wait is 3 months, 6 months, right? But obviously, if you have cash, it's a different story, But for the people who have public insurance, Medicaid, Medi-Cal, is easy because we make that, it is our responsibility and we make that network, right? I don't know. Do you have that experience? Do you hear that from friends in terms of the shortage of mental health providers?
So when I was practicing directly with patients, we are like the desert when it comes to having any type of mental care for anyone who has insurance. Because if you're going to try to find services for therapy or a psychiatrist, it's going to be months. Good luck, 3 to 6 months minimum. And then on top of that, usually the provider you're trying to see will not take your insurance, which is kind of interesting, right? Like, so usually you have to end up paying out of pocket. And even then, there's just long waits. So just trying to get care is difficult. I think like when I had a crisis, I ended up calling you to request, how do I get care? Because the other thing is you want to trust who you're going to get care from, right? And that's difficult. But if you're looking at a wait list, there's so many barriers to getting care. And then a lot of primary care clinicians, some feel comfortable with starting and treatment and starting that journey, but some do not. And so hopefully, you know, we're getting more primary care providers trained, and there's more training programs to get them more ready to at least make the initial diagnosis, start the treatments with their patients, and hopefully that will continue to happen.
That's why I think the ocnavigator.org website that we created and support is so important.
Yep.
Gosh.
Right. I do also want to point out that it's very difficult for you to have us ask you questions. So
I know.
You just took back over. So let me just ask you another question based on what Annette just asked you. What kind of symptoms were you experiencing? It wasn't just suicidal thought. What other things were going on with you when you were in the throes of that?
Oh gosh, I remember the first episode. I'm hinting that I have a multiple episode, right? Because once you have depression and you get over, you don't really, it's not a cure, right? You have to do other stuff to maintain it, right? So how do you live with depression? But the first set of symptoms, it took me by surprise. Like I wasn't able to concentrate. I was failing tests. First time in my life, failing tests. I wasn't eating right. I was not sleeping. I was hearing voices, right? And so I remember the psychologist referred me to a psychiatrist, and you know that was in the early 90s, and still they see you 10-15 minutes and then they prescribe, and that was the time when we have the older generation of antipsychotic medication, Haldol.
Right.
I remember I was giving like 2 milligrams, and after 3 nights, yeah, the auditory hallucination went away. But I was becoming restless.
Yeah.
I couldn't sleep. And I remember distinctively at night, I felt paralyzed, right? But so uneasy on my legs, it's restless. And I didn't know what it was. And I just feel so uncomfortable. Called the psychiatrist the next day, and he said, oh, well, you just have anxiety, so let's increase the dose. So you know what happened to that, right? I stopped the medication, and I never told him that I stopped the medication. So those are the kind of things. I mean, so I learned to really appreciate and pay attention when patients complain about side effects, you know, because you have to pay real attention to it. Because later on, now we know that people who experience those kind of side effects also put them at risk for suicidality, right? And so...
Yeah, I think it's very important that you share those symptoms, because many of us experience some of that. We're not sure what it is. So it's really great. It's a great space for us to really start. But let me ask you, Dr. CK. Mm-hmm. So can you share your experience with mental health?
Yeah, I think I was undiagnosed for a while, right? Didn't really hit me until after I delivered my first son. I was in my second year of residency, so that was already difficult. I had long hours, barely eating, barely getting any sleep, and then also trying to breastfeed my child. And I think it was just too much to the point where I had severe depression. And I was already a physician at the time, so I was already taking care of women who had postpartum depression. I knew the whole screening task, and yet I missed it in myself. I got to the point where I also had suicidal ideation. It was the first time in my life, and I did make a call to my sister, luckily, and that saved me. I was ready to ride off a bridge because I
it wasn't enough to be a mother, right? I had my first son, but I didn't think I was enough. I already had self-esteem issues even before med school, and it just came to a peak. I wasn't enough as a mother. I couldn't handle residency. I wanted to quit residency. And luckily my sister picked up the phone when I called her to say, I'm done. And she luckily kind of already knew something was up and was able to talk me down off that cliff, right? And it was, after that moment that I went back to my residency program and I checked myself in. I said, okay, I obviously have an issue. Of course, severe depression was diagnosed and got on medication, but it's not really the medication. The medication just takes the edge off, but the therapy was really important. And unfortunately, I think at the time, the therapist I was talking with, I just didn't feel that connection. So what ended up helping me was actually friends, colleagues that helped me through that difficult period. And after having that experience with my second son, I just told my friends, family, and said, hey, look, if you start seeing that, like, I'm not connected with you, I'm not really happy, I'm starting to disconnect, please get me help, like, tell me, or find help for me. So it's more open to treatment the second go around, but, when you don't take care of yourself, there's just not, you don't have that reserve. And so it's too easy to jump off the cliff, right? And I wasn't myself, and I didn't have voices, but I just had this internal, you're not enough. Like I was pretty much saying I wasn't enough and that I needed to end it. And that's not me. I'm usually someone who's very supportive of everybody, really wants the best of everyone, and it was just an interesting time.
And I think it's important that you say that. Number one, that you're sharing this story here with our viewers, and that's the most important thing. Mental health concerns are common, but treatment is available, recovery happens. But in particular, because this is Mental Health Awareness Month, the theme this year is #MoreThanEnough. And it's a time for us to remember that we are all more than enough, regardless of whether you are a teacher, or you're a student, or you're living on the streets, how much money you have in the bank, what your abilities are. You are more than enough. And that's an amazing message for us to hear. I think it's one we have to continue to share with our communities.
Yes.
I think it's particularly hard. It's hard for any family, but I think culturally speaking, it's very hard for the Asian culture because of that set of expectation, right? I remember back then when I was going through it, I was first one in my family going through medicine, graduate school for that matter. And so there's a lot of pressure, but internally there's also a lot of self-pressure. So when I was hit with depression, I didn't understand what was going on. And obviously, I didn't have the courage to share that with family. So luckily, I have roommates at that time who was very supportive of me. I mean, I'm so forever grateful. We still have that friendship. In particularly, one of the roommates' classmate, who's a psychiatrist now. The two of us talk about it because she also suffered from it. I remember years later mentioned that to my mom, and she was having such a hard time, right? Because she was also going through depression at that time because of the marital problem that my parents had. Right. And we connected that way. And so it's very difficult because, my mom just passed away 6 months ago. So that deep connection is what I'm confronting now, right? It's so hard. But you alluded to I'm being open about it. There was a YouTube video that LA Department of Mental Health did on people who professional but in recovery, and I talk about that. When I did that video, I wasn't expecting anything, and I didn't think anything of it, even though they told me we're going to submit it to PBS. Actually, the series that I was in won the Emmy Award, and so, but they posted on YouTube, and they called me and said, hey, we want to post it today. And I said, okay, it's helpful. Here locally, I've been talking about it. My aunt who lived in Texas saw the video. because the PBS station in Houston showed that. And she called me immediately and she said, we didn't know. And I said, how would you know? It's such a huge stigma in our community that nobody talk about it. And that's when we talk about my cousin, we talk about other uncle that have tried a suicide attempt and all of that, right? So we are very mindful to talk about it now. And now once in a while she'll call me, what do you think, right? Oh, this person in church is suffering from this and that. But it's a hard thing to talk about. I mean.
Well, I think this is the month for us all to start talking about this, have the dialogue. So wear green, wear lime green. That shines a limelight on the importance of mental health. But then spend time talking about, in a positive manner, our own mental health. I just am really impressed and always am with the level of transparency that you, Dr. Chow, have, and Dr. CK sharing this. You are two very high achieving people. You are super smart, right? You've done a lot of things in your lives. And so for you to experience behavioral health concerns, that is a great equalizer, I think, because we all have behavioral health concerns. We just have to talk about it and talk about it in a positive manner. So I don't know if you have another question, but I have another question. So Dr. Chow, what kind of stigma have you seen related to, not just in your own community, but here in the county with relation to mental health issues?
Oh, huge. I could tell you, at the height of I don't know if you remember, at the height of the pandemic, I mean, we had a lot of people who protest and what have you. And I remember distinctively, it was, I think, December, because it was right before the vaccine arrived. One of the protesters actually got up in front of public and the board supervisor and talk about my mental illness and judge that how could the public trust a health officer that have depression. And I was so shocked at that time that I was speechless. I didn't say anything. And I remember the subsequent meeting, I came back and I was angry because what he did was stigmatize mental illness, and there was kid who's watching, what have you. And I was so angry, and I said, don't you ever, ever say stuff like that to stigmatize depression. There's nothing wrong with it, right? Mental illness does not discriminate. I don't care who you are, everybody's at risk of having mental illness. Depression, anxiety, ADHD, bipolar illnesses, schizophrenia. But what you said, I truly appreciate, and that is treatment works and prevention is really effective, or the other way around.
Right.
Treatment is effective and prevention really works, and recovery is possible. Your daughter.
Look at you too, right?
Your daughter, right? Beautiful,
many of
give you
us.
beautiful grandchild. I mean, you share on Facebook, and I look at her and I thought, oh gosh, this is beautiful. This is wonderful. We need to talk about that, right? Nobody's immune from mental illness, right? And then on the addiction as well, I mean, all these famous people suffering from bipolar illnesses, addiction, some die, Robin Williams, you think he's the most successful person, comedian, ended up dying from suicide, right? The famous, right? Yeah. And then for those women who wear Kate Spade, I mean, who knew?
It's true.
Right? I mean, successful people are also not immune to mental illness or addiction, right? Certainly, Asians are not immune to that.
Nobody. That's the important thing, right? We are all in this together.
Yeah.
So as we wrap up, let me just point out for everyone here that this is Dr. Chow's last event, his last show here with us, and really important. His health, your health always will matter to us. Certainly the focus that you've brought to the community on the community's health mattering is really important. But can you share what this has meant to you, your time here at the agency, as well as having this platform to stand on?
Yeah. Before I do that, there's a question from Dave. Thank you for sending in the question, Dave. Dave asked, when a loved one is really not themselves and begin to act recklessly and impulsively but refuses treatment, what can family do to get them help? I would have two advice for you. Number one, get the support for yourself and your family by contacting NAMI Orange County. Okay, you can go and Google NAMI Orange County and then call them, or you can reach NAMI through navigators.org. Okay, and the other way is call navigator.org. We have clinicians that will send, if you're in the moment of crisis, we'll send clinicians to your home to assess you, and then they'll follow up and make sure that your family's safe, your loved one is safe. Yes, the unfortunate thing is, in our country, people have the right to refuse treatment. If they're an adult, there's nothing we can do about it, right? But what you could do is make sure that you know the right thing to do to support them once they are in crisis, and you know how to support yourself, and then have people know to be on the alert that if the crisis hits, you know how to respond and they know how to respond. This is my last show. This has been our baby. I think you find it helpful. I think it is helpful, and I know you're going to continue with this. I think this is one of the important ways for us to communicate with the community in a humanistic way, right? Humanize all the health conditions beside mental health and addiction, and provide resources. Navigator.org, how did I do? Good. This last 3 years of the pandemic seemed like 30 years, but it was such a short time, right? It affected all of us. I'm taking a break because I really need to take care of myself. And I think I talk about my mom passing really has a huge emotional toll on me. And I know I need to take care of me, just like we all need to take care of us. So I encourage you, if you are struggling, you really need to take care of yourself. And I know the preacher always preaches but doesn't practice. Right? This is what I'm doing, is to practice what I preach. I'm not moving away from Orange County. I don't have any concrete plan yet. I'm going to take at least 2 months off to really take care of myself emotionally. Get the spark back, and then I'll be involved in the community. So I'll be looking for your work. I'll be watching the show. I don't know what else to say. It has been a privilege to serve our community. I always share with people, we all went into medicine, went into a clinical work, so one day we can serve the community, in a big way, right? I mean, the pandemic is the dreadful thing that happened once in a century, but is also a chance, negative, but nevertheless, it's a chance for us to contribute back to the community and do what we can to ensure that we have a safe environment. So with that, I'm grateful that you didn't quit when the pandemic hit, and I'm grateful that you came to Orange County, you didn't quit, and I'm grateful you came to Orange County so that we can work together to support our community, so that we have a healthy county, and we do. I mean, if you look at the numbers of Orange County, we actually do have a healthy, right? So.
Well, I just want to say it's been a great honor and privilege to work for you and with you. You've been really an inspiration to many at the agency. And for those who are in the public who really haven't known Dr. Chow, he's inspired so many in our county to really do the right thing. And we had the Chila event earlier today, and I'm hoping that you heard the love from that room.
I did.
Everybody really honors all the work that you do. So disregard all the negative comments that you receive from the public. There's so much positive, and we're really going to miss you, but we're going to keep you on speed dial because we know that you're still around. What I'm really happy about, though, is in the last month I'm starting to see that spark again. Because I know I've worked with you before you were in the county, and I'm starting to see you come to life again, which is really good. So I know you're going to do even bigger things after the county, I'm sure, but we're so grateful.
I think I've known you the longest here.
Yeah. You hired me.
I hired you.
For those who don't know, it was Annette who hired me to the county.
But you are definitely going to be missed. Your legacy was the first time, and you started so many things in the clinics, in the outpatient clinics, that you pushed the envelope. You made people see things differently, and you didn't give up. And you came back, and you did the same thing with the pandemic. You pushed the envelope, and you made people see that mental health matters, that mental health is important, the masking, all the COVID. You really will leave a legacy here, and you will be very missed.
You're determined to make me cry again.
Yes,
Right?
yeah, I will say on behalf of Mental Health and Recovery Services, the communities that we serve, and the healthcare agency, you are a man of vision, and that vision has really resulted in so many amazing programs and just changed the experience that we all have with the community. You were sharing your behavioral health experience before it was the thing to do, and I think that's the sign of a Renaissance man, and I think we all see you as that. So we will miss you.
Thank you
very much, and we thank you for your service.
Oh, thank you, and thank you, the audience. I mean, obviously you're watching because you support us, spread the news. Really, the county, the county health system in Orange County is top-notch. We do good work that not many people realize that, right, until they have a crisis and then they know. But we're here for the community. We have so many prevention programs that we serve the community. You just need to look for us at navigators.org. Hint, spread the word. Please share with your friend and family who live here about navigator.org, because I guarantee you, we are just at the beginning of this perfect storm of the mental health crisis and addiction, right? It's coming. We're now seeing the effect of mental health on our children, particularly from the last 3 years, on our seniors on the last 3 years, right? So mental health awareness is so important, right? We're all in this together, right? We have a network, a system that we have created to support everybody. So utilize us. The warm line, NAMI services, our hotline, right?
988.
988 is launching in this country now. If you don't know, you really need to find out about 988, right? Have it ready. Make sure that if you, like Dave said, if I have a family member or friend behave out of the norm, right? What do I do, right? Recognize those as a sign, and then walk them through help. You don't need to be the one who do the prevention work, because you're not the expert, but you need to learn to have resources at hand so you can walk people through that process to get help. With that, I'm grateful. Thank you.
Thank you.
Thank you.
Thank you so much. We'll see you. You going to see people?
So we'll see you in the future, probably in the next month. And I'm so sorry I don't have the next agenda or item that we're going to discuss. But we will see you in a month here at Your Health Matters OC. So till then, please take care and start talking about mental health.
Thank you so much. Good night.